If you're taking your blood pressure at home, or even having it taken at a doctor's office, there's a good chance your reading is wrong. In fact, most people don't realize that blood pressure is one of the most frequently mismeasured vital signs in medicine. Even in many clinics, they sit you down, slap the cuff on, and take a quick reading without any preparation. And that number often ends up higher than your true resting blood pressure. So why does this happen? Because your cardiovascular system is sensitive to even the smallest changes in stress, posture, temperature, as well as movement. When the cuff compresses your arm, it temporarily alters blood flow and tissue pressure. If you retake it too quickly, within 30 seconds or a minute, your vessels haven't had the time to reset, and you're likely to get a false high or low reading again. And that's why you need to wait at least 1 to 2 minutes before taking your second reading on the same arm. But let's back up. If you want to get a truly accurate and consistent blood pressure reading, here's exactly what you need to do. It starts before you even sit down. First, don't drink caffeine within 30 minutes. It's a stimulant that raises your heart rate and constricts your blood vessels, both of which can elevate your blood pressure artificially. Don't smoke, as nicotine has similar effects. It causes your arteries to tighten and your heart to beat faster. Don't eat a heavy meal right before measuring. Digestion diverts blood flow to your gut and can alter your vascular tone. And don't talk during your readings. Many people do. Speaking activates the sympathetic nervous system, which temporarily increases blood pressure. Even a light conversation can push your numbers higher. Also, avoid crossing your legs. This compresses blood vessels. It increases more vascular resistance, especially in the lower body, which can elevate readings. And don't forget to empty your bladder first. A full bladder will definitely stimulate your sympathetic nervous system and will raise your systolic pressure by up to 20 points. Sit quietly for 5 minutes, always, before taking your reading. No scrolling, no distractions, just let your nervous system settle. For consistent tracking, it's wise to take your blood pressure at the same time each day, ideally in the morning before bed or meds. And here's something most people don't know. Even in a doctor's office, blood pressure is often taken immediately after walking in, sometimes while seated on the exam table, talking to the nurse. That's not a true resting reading. It's a rushed one. You have the right to sit there quietly for 5 minutes. Inaccurate readings over time can lead to unnecessary medications or anxiety. The truth is, blood pressure is a moving target. It can change based on stress, posture, hydration, breathing, and even how you hold your arm. But with a few small tweaks, you can get an accurate picture of what's really going on in the inside of your body. Whether you're managing hypertension, watching trends over time, or just being proactive about your health, how you measure your blood pressure matters just as much as what it says. And here's what's really important. When you're ready to take your blood pressure, you want to sit up in a chair with your back supported, your feet flat on the floor, legs uncrossed. Rest your arm always at heart level. Very important. Either on a table, if this table is too low as it is, then put some pillows up there, whatever it takes. Make sure your sleeve isn't tight or rolled up over the cuff, as it can create pressure points. You want to use a validated digital monitor at home with the correct cuff size. Too small, and the reading will be too high. If it's too large, the reading may be too low. When you put the cuff on, you'll pull it apart, then put it on, but for our purpose, I'm just going to slip it on. If you look here, the cuff should be 1 inch above this crease right in the middle here, on bare skin if all possible. Always put it on bare skin to get the best accurate reading. You'll press start on your machine, but don't move, don't talk during the reading, and once complete, you'll wait 1 to 2 minutes, and then take a second reading, preferably after 2 minutes. If the two differ, the first two readings differ by more than 5 millimeters of mercury, take a third and average the last two. That's the consistent way. So for consistent tracking, take your pressure, again, at the same times each day, ideally in the morning before food or meds. So take the extra time, follow the steps, and let your body show you the real numbers without interference. I hope this video was helpful. Please share it with your friends and family. Leave your comments below. And most important, make it a great day. I'm Dr. Alan Mandel.